All right, thank you guys again for coming. Again, this webinar is sponsored by Coloplast. We appreciate them sponsoring this. The goal of this is really to give some facts and some information on the management of erectile dysfunction. In general, there are a lot of options out there, and sometimes you may or may not know about these options. So we'll go through the pathophysiology of erectile dysfunction, how it's caused, and then most importantly, how it can be treated. Some housekeeping, you are anonymous in this platform and your mics have been turned off. So feel free to type questions in the questions section. Each of your questions will be answered and addressed during the question and answer portion at the end of the webinar. If you are signing in from a smartphone and only see the chat section, there's a drop-down menu on the upper right-hand corner to switch to the slide deck. And then the webinar is being recorded, and will be emailed out by Advanced Urology in the next couple of days. So you'll be able to watch it, or if you or your friends or family want to watch it again, you're welcome to do so. Okay, a little bit about myself. My name is Bhavik Shah. Many of you may or may not know me. I treat all aspects of urology, but my passion is really management of erectile dysfunction and really quality of life management, so urinary incontinence, things like that. My focus has been on, again, improving quality of life, penile length restoration, erectile dysfunction, just men's health in general, and that's sort of what they brought me in for. I'm well published in all these aspects. I do quite a few surgeries. One of, I believe, only 2 centers of excellence in the state of Georgia for the penile implant surgery, and I'm just very passionate about what I do. We also welcome Richard and Chuck. These are 2 just awesome people. Both have undergone a lot of the treatment options we're going to talk about, and they have, volunteered to be patient educators. So which I very much respect. And you become a patient educator because you're passionate about helping other patients go through and get through the process that you went through to improve their quality of life. And so I do really appreciate them joining us today, and you'll have a chance to hear them talk about their experience as well. So our agenda, again, we're going to talk about erectile dysfunction, the causes. We will then move on to what everyone here mostly wants to hear about, which is the treatment options. And then we will have our patient educators talk about what they went through and what their thoughts are on a lot of these treatment options. We'll also have opportunities to answer a lot of the questions that you may have. Okay, so what is ED? ED is a consistent inability to keep an erection or have an erection sufficient enough for sex. It's the total inability to get an erection, the ability to keep an erection, and then the ability to have one strong enough for penetration. And in general, if someone asks me what is erectile dysfunction, it's a decrease in your erections compared to where you were before that's causing you to have dissatisfaction. Some facts about erectile dysfunction: about 30 million Americans suffer from erectile dysfunction. That's 1 in 4 men experience some form of erectile dysfunction. Most men still have the ability to father a child, but oftentimes can have difficulty doing so because of erectile dysfunction. It's not normal to have erectile dysfunction. It's true that aging does increase the risk of erectile dysfunction, but that's more so because of the comorbidities that come with aging, and we'll talk a little bit more about that. So research has shown that over 80% of men suffering from ED, the actual ED can be traced back to a physical problem or disorder. So for most men, we call that organic ED, where you can trace it back to a physical problem. There's also something called psychogenic ED, where it's attributed to a psychological problem, maybe stressors, things like that. Physical problems include either injury or neurologic issues like spinal cord injuries, brain injuries, diseases that are very common as you get older, diabetes, heart disease, high blood pressure, things like that, and operation, which is like prostate cancer treatments, or even substance abuse, tobacco, drugs, alcohol, medications. ED is a marker for heart disease, and so many of our patients that have erectile dysfunction will oftentimes refer them to get a heart evaluation. And the reason is because a lot of erectile dysfunction is caused by what we call arterial deficiency. What that means is the blood vessels that treat or fill the erectile bodies in the penis are clogged. And so you're not getting good blood flow into the penis. And if the small vessels in the penis are clogged, the next thing that's going to get clogged are the big vessels in the heart. And so oftentimes erectile dysfunction can be a precursor for heart disease. So risk factors for erectile dysfunction. You'll notice aging is on this list. And again, aging is a risk factor because a lot of these other things, a lot of these chronic diseases, the risk of you having those increase as you get older. So just because you're older doesn't mean you have to have erectile dysfunction. But as you get older, you tend to get high blood pressure, you tend to get diabetes, you tend to get depression, heart disease, you tend to be more likely on high blood pressure medications. And for these reasons, you have a higher tendency to have erectile dysfunction. So here we talk a little bit about aging. So you see, because of these things, you can get progressive decline in your erections. You can also have a progressive decline in your psychological function, which can also lead to erectile dysfunction. The more frequent causes are going to be something related to chronic diseases. When it comes to chronic diseases, two of the biggest causative agents are going to be diabetes and high blood pressure. Amongst patients with diabetes, you'll notice that as you get older, you're more likely to have diabetes. And the longer you've had diabetes, you're more likely to have erectile dysfunction. Again, with diabetes, you get a lot of other problems. Diabetes causes neuropathy, where you lose sensation in your legs and hands, but a neuropathy can also affect the nerves to the penis. So that's why you can lose the ability to have erections. It can also cause heart disease, so it does increase the risk of your blood vessels getting clogged. It can also cause a lot of other body issues, and those body issues include vision changes, kidney diseases, things like that. So it's very important to keep your diabetes in check. The worse your diabetes, so the poorer the glycemic control, your sugar control, the quicker you will get erectile dysfunction. Now, when it comes to high blood pressure in and itself does cause erectile dysfunction because it increases the risk of getting plaque formation or clogs in blood vessels. But the treatment for high blood pressure, which lowers blood flow, also causes erectile dysfunction. We'll talk a little bit more about that because it decreases blood flow, and that includes a decrease in blood flow into the penis. So a lot of these chronic diseases we talked about, diabetes and prostate disease, are two of the highest risks of erectile dysfunction. Then you have peripheral vascular disease, cardiac problems, hyperlipidemia, which means high cholesterol, hypertension. So all of these things increase your risk significantly of having erectile dysfunction. You can see diabetes is the biggest causative agent. And part of that is diabetes also can cause a lot of the heart disease and the high cholesterol and the high blood pressure. They're oftentimes related. Now, with prostate cancer, this is a very, very, very common cause of erectile dysfunction. Not so much the prostate cancer itself, but more so the treatments for prostate cancer. So things like radical prostatectomy, where we remove the prostate. And by removing the prostate, the nerves for the penis, which run right around the prostate, can get injured. You're also tying off blood vessels to keep the bleeding to a minimum, and you're tying off this major blood vessel called the DVT, or the large vein that drains through that area, and all of that can cause erectile dysfunction. Radiation therapy tends to fry blood vessels, and this prevents blood flow through the penis, and this can also cause erectile dysfunction. With radiation, it actually gets worse with time. So you see radiation effects further away from the time you got radiation. Smoking increases your risk of erectile dysfunction by 2, so twofold. And medications like thiazides and beta blockers, which you oftentimes give for heart disease or for high blood pressure, are also common causes of erectile dysfunction. And again, these blood pressure medications decrease blood flow, and that's the general cause of it. Now, how does an erection occur? Well, you have these two large bodies inside the penis, and those bodies fill with blood. And when they fill with blood, a second, let me see if I can. So these large bodies right here and right here, what they do is they fill with blood through arteries. And when they fill with blood, that's called an erection. There are veins around there. See here, all these blue things, right? These blue things are veins. And what happens is when these erectile bodies engorge, giving you an erection, what they do is they actually squeeze these veins off. And when they squeeze the veins off, it allows you to keep the blood inside the penis and keeps it from leaking out, so you can keep the erection. Now you can see as these bodies engorge, they actually trap the blood inside of them. And so when they're able to fully engorge and squeeze the veins shut, that's when you're able to not only have an erection, but keep an erection. Now, treatment options for erectile dysfunction. This is what most people are here for, so we'll go on to this. All the treatment options, and even before we do an intense workup, everything kind of starts with the oral medications, right? So the oral drugs. These are your Viagra, your Cialis, your Levitra, your Stendra, your Staxin. These pills help you not only have an erection, but potentially keep an erection by increasing nitric oxide release from nerves. They have side effects like headaches, facial bleeding, upset stomach, temporary vision changes, back muscle pains. They're also can be very expensive. And so, these medications can be as high as $10 to even $150 a pill. And so that's like saying every time you want to have sex, you have to pay $10 to $150 a pill, which is basically prostitution in my mind. But that being said, they can be very effective. And in general, I try to start with the medications because they're generally well tolerated. And for men with very mild and very, very mild erectile dysfunction, they tend to work pretty well. When you fail the meds, the next step is going to be to do an ultrasound with an injection. This is called penile injection therapy or intracavernosal injections. What this injection does is it increases blood flow through the penis. And by increasing blood flow through the penis, you're able to engorge the penis without the need for stimulation. The difference between injections and the oral meds is the oral meds require stimulation in order to get an erection. With the injections, you can get an erection with just simply one injection. The other difference is the oral meds depend on nerves to release nitric oxide. Nitric oxide is that substance that's released by them that will increase blood flow through the penis. On the flip side, the injections don't require that. When we do an ultrasound, what we're looking for is blood flow into the penis. We're looking for blood flow out of the penis to see if you're able to keep the erection. And we're looking for scar tissue formation. I'm also looking to see how well you respond to these injections. The reason is because if you respond too well, you can end up with something called a priapism, which is an erection that lasts too long. And that's an emergency that can land you in the emergency room where they inject several needles trying to drain the blood out. And that's something that you don't want because it can be very traumatizing. It also has the possibility of just injection site pain. It does require some training. You do tend to get some bruising. It can cause some curvature if you keep injecting the same site twice. And in the long run, most people tend to sway away from it. But overall, it's a good treatment option. It's a good treatment option to try. And it is something that about half the men will say they'll want to try if they have a good response to it. You also have a vacuum erection device. The vacuum erection device is the most cost-effective way to have an erection. And what it entails is a device that you put over the penis, you push a button or you hand pump it. The suction effect will pull blood through the penis. And generally, you'll have to slide a ring that goes around the cylinder onto the base before you remove the cylinder to keep the erection. Now, overall, it's well tolerated. The problem is if you've ever put a rubber band around your finger, it tends to get kind of blue and clammy, and you tend to get the same kind of effect. It also blocks your ejaculation because it's constricting that channel that you pee out of or ejaculate through. It's not doesn't have the highest satisfaction rate, but I'll tell you, it is good for a couple things. It's good because it pulls blood flow into the penis. It can maximize some lost length and girth. We call that disuse atrophy. It can maximize that by using it regularly. It's not the greatest for sex, but it's cost effective and it's something worth trying if you're interested. We have insertable drugs. I'll tell you, this is probably the least used method, primarily because number one, it's very expensive. Number two, it's not well covered by insurance. And number three, it causes a lot of burning when you pee. And the way these insertable drugs work is you insert either a pellet or a gel into the channel that you pee out of, and then you sort of rub the penis and try to get it absorbed, similar to the injections. In general, this is a great option for men that only have a partial response to the oral medications like Viagra, Cialis, and they're trying to get a little bit stronger response by adding this. Then you go on to the penile implants. Now, in general, there are two types of penile implants. You have your malleable penile implants. I call this the Toyota of penile implants. These penile implants are simple, they're dependable, they're reliable, they get the job done, okay? And they're not very tech savvy. These implants, in general, they're simple in that they're just simply two rods that go up and down the penis, right up here and here. And that's it. There's no inflating, deflating. The best thing about them is they're always up and they're always ready to go. The worst thing about them is they're always up and they're always ready to go. So, the good and the bad is that they're simple and they get the job done. The other negative to these implants is that in order to put them in, I do have to be a little bit more conservative on the sizing. So I can't get as aggressive on sizing. In general, you'll tend to lose about half a centimeter in penile length after this is put in. They're also not quite as girthy as the inflatables that we'll talk about, but they're a little bit more cost effective. They are covered by insurance. And in general, the satisfaction rates are very good. They're about 89%. Now, on the flip side, you have what I call the Lexus of penile implants. It's just like the Toyota, except it's more tech savvy, has more gadgets. It's just as reliable. There's just more that you can do about it. With this one, you have these cylinders inside the penis, just like the other one. You have a reservoir hidden up here in this natural space called the space of Retzius, and you have this pump hidden down in the scrotum. Everything is hidden, you can't see any of it, but what this implant allows you to do is inflate and deflate the implant whenever you want. So you have an erection when you want, and you're deflated, and you don't have an erection when you don't want it. You can keep this implant up for as long as you want, you can have sex for as long as you want, you can bring it down whenever you want. So in some sense, it almost makes you superhuman because you are one of the few people in the world that can have an erection for as long as you want, keep it up as long as you want, and bring it down when you want. It feels a little bit more natural. It has a little more natural look when it's inflated. It's also girthier because, and I can get more aggressive in the sizing. So in general, most of my patients tend to maximize their length or even gain a tiny bit of length by using the inflatable option. The negative is there is a little bit of a learning curve to the pumping mechanism. Here is a video which I'll play. Let me see if I can play it. Okay. And so what you can see is here's the penile implant. There's a reservoir that we talked about up in the spacer retius. Those are the cylinders inside the penis. And there's the pump down in the scrotum. Now, what you do is you learn to find the pump, you give it a couple squeezes, and when you squeeze it, the fluid is leaving the reservoir, going into the penis, and filling it up with fluid. You can keep that up as long as you want. You can have sex whenever you want. And when you're ready, you learn to find a little latch, you squeeze on the penis, and you're able to bring the implant back down. Okay, so now there are risks to all surgeries in general. There's a 1 to 3% risk of infection. The look of the penis is very natural when it's up, but when it's down, it tends to have a slight rubbery feel to it. There is a less common risk that the implant can find its way out of the body. That's called a risk of erosion. There is a risk that something can move during the healing process where the implant can move, the pump can go up a little bit higher. So sometimes you need a revision surgery to kind of put it in a better place. In rare instances, you can have chronic pain. Typically, it's self-limiting and goes away. And sometimes it just takes a little bit longer. And then you can have a device malfunction, which means the implant can break down. In general, the penile implant lasts about 10 to 15 years. Data shows 88% of them are still going strong at 10 years. If they break down, we just swap the whole thing out for a new one. These both implants, the malleable penile implant or the Toyota penile implants and the Lexus of penile implants, which is inflatable, both of them are well covered by insurances. They're in general, maybe with the exception of Medicaid, even Medicare covers them. So it is something worth looking into if you're interested. And there are ways to get, health plans or get some sort of support or help if your insurance doesn't cover it. So we do have alternative financial options, and if ever interested, we can always talk about that as well. You can go to either one of these websites, either labombita.com or coloplastmenshealth.com. You can also go to the advanced urology page to learn a little bit more about some of this information. I also have several videos on my webpage. If you go to my page on the penile implant, what to expect, recovery, etc. And of course, you can watch this webinar as many times as you'd like. Okay, so after all of that being said, I'm gonna ask that both Richard and Chuck, I'll turn it over to Richard first, give their experience. Maybe they can talk about some of the treatment options they've tried, what they went through prior to and during the penile implant, recovery, pain, discomfort, and how it's impacted their life and maybe even their partner's life, their intimacy, their spontaneity, confidence, and anything else that they want to share. So I'll go ahead and turn it over. I'm going to go ahead and mic my audio for right now.
Good evening, everyone. Dr. Shah, can you hear me?
Chuck, I don't think we can hear you. I think your audio is turned off.
Can you hear me, Dr. Shah?
It's Dr. Shah. It's Richard that's speaking.
Can you hear me, Dr. Shah? Can you hear me, Chuck?
I can hear you.
Okay. Well, I'm gonna go ahead because Dr. Shah has his off.
Okay.
Good evening. My name is Richard Godfrey. I am a patient educator for advanced neurology and Coloplast. My story is a little different than everybody else's, and due to time restraints, I'm going to give y'all the short version of it. I was diagnosed with prostate cancer approximately 2.5 years ago. I went to advanced urology, just a regular visit, and at that time, one of Dr. Shaw's partners, Dr. Balani, he found out I had prostate cancer. We didn't waste any time, went straight into the surgery. He gave me my options as far as what options I had. We decided to go with surgery. And during the surgery, there were some nerve damages which caused me to have erectile dysfunction. Um, to me, this was a big deal. A lot of people say it's not a big deal. To me, it was a big deal. Being sexually active all of my life, I no longer had the opportunity or the chance to even get an erection. So after I recovered from the surgery of the prostatectomy, I talked to Dr. Balani, and he told me what options I had as far as the ED. Um, so we went straight into the pills. I took Levitra, Cialis, Levitra, Viagra, you name it. I took it all. Nothing helped. Nothing helped. So now I'm panicking. He told me, "Don't worry, Richard, we got something else for you." So again, this time I tried the injections. Now, what works for me may not work for everyone, but I can tell you those injections was very painful. Um, I didn't like them. You have to stick yourself in the penis with them. And like Dr. Shaw said, you may have a side effect of a priapism, which is an elong or a erection that lasts an extremely long time. So after my first injection, I got no results. I didn't get I didn't even get an erection with my first injection. The second injection, however, I did, and the erection lasted for 8 hours. So I had to end up going to the hospital, and upon my first visit there, I had to explain to the young lady and the young guy that was at the front desk, I had an erection that that will not go down. And they actually, since they're both young, the young guy, he was gay. He was like, "What's the problem?" "Well, I got an erection. This thing is painful." And after 4 hours with an erection, trust me, it's very painful. And after this happened for about 3 times, I told Dr. Balani, I can't do this anymore. What other options do you have? So he gave me the other option of penile implant. So I went to Dr. Shaw, and when I went to Dr. Shaw, he told me what my option was as far as which implant I could use, and I chose to go with the Titan, which he says the Lexus. I called it the Rolls Royce. To me, this is the best thing that ever happened to me. I am now 54 years old, and I'm gonna be honest with you. It's the best thing that ever happened to me. That's all I can put it like that. I had a little bit of swelling, which was normal. He explained to me all the side effects that will come with the implant. I had some swelling, and immediately my wife, she did not agree with it. She was totally against it from day one. From day one, she didn't want it. She didn't. She was like, "No, it's like you're gonna have a dildo strapped to you." And one of the things that I do as a patient educator, I tell all the gentlemen that come in, get your wife or get your spouse involved. Get your significant other involved. That way they can understand what you're going through. My wife was thinking that I was going to have this long rubber dildo strapped to my body that Dr. Shaw was going to sew to my body, and that's what I would have. Not true. Um, the only reason anybody knows that I have an implant is because I tell them. If you look at me, if you look at me when I undress, you would never know it. You would never know. Um, and it was a problem. My ED has gotten so bad that I was at the verge of getting a divorce because I need to have sex. We're taught at an early age as young men that you need to have sex. The more people you have sex with, and that's what we're instilled as little boys. So this theory of having sex all the time, it stayed on my mind. And being sexually active, I needed to have sex. And after my prostatectomy, I couldn't have it. But lo and behold, thank God and thanks to advanced urology and Coloplast, I am now sexually active. I have no problems whatsoever as maintaining and getting an erection. I can, like he said, I can get it when I want to. I can leave it up. Sometimes I leave it up 2, 3 days at a time. Um, I don't have any problem as far as the pain. When I first started with the implant, I did have some pain. I did have some neuropathy in that area, but that was fixed. I called Dr. Shaw. He told me what to do. He was there. I mean, the whole advanced urology crew was excellent. I mean, from start to finish, even today, I don't have any problems now. But I didn't have anyone there to talk to me about what to expect as far as with ED. especially with the surgery. I had no one there to tell me, well, this is what you need to do, or you have swelling, you need to put ice on it, or you need to wear compression pants, or you need to do this. I had no one to tell me that. So it was hard for me. So when Dr. Shaw mentioned this, I was like, sure, I love to talk to people about it. And like now we have I tell anybody, once you get my number, you can call me 24 hours a day. I don't care what time, call me. If I'm asleep, as soon as I wake up, I'm gonna call you. You wanna call me 2 o'clock in the morning and ask me a question, you're welcome to do it. If you wanna call me 4:30 in the morning, you're welcome to do it. I am here. We're here for your protection, for your advice, and for your support. That's basically it. Um, Again, I would recommend the Titan, but again, everybody is different. What might work for me may not work for you. But I can honestly say, with what I went through as far as the ED and no sex whatsoever, had I known this was available 10 years ago, I would have I would have definitely signed up for it. Again, this is one of the best things, one of the best decisions I ever had. Um, and I love it. I'm be honest, I love it. I love it. There are some issues that everybody's going to face, but again, with the implant, the support that we have, and Dr. Shaw and his crew, it's a great part of your life that I promise you will not forget. You won't regret it. And one of the things I talk to a couple of people all the time, and as you said, Dr. Chuck, he's going to come up next. He was one of my first clients, or one of my first patients that I talked to. And I remember when I first met him, and I'm gonna let him tell his story. But just to let you know, he was very apprehensive about having this procedure. And after I talked to him, I was calling him every week. We was on the phone every week. When he had his surgery, I was there at the center with him and his wife when they had the surgery, when he had the surgery. So me, my support system is there. I'm going to support you. We're brothers now. I love Dr. Chuck. He's an excellent man, and he's just great. And I'm sure he has a story that he can tell. But again, if anybody have any questions, my number will be appearing up here later on. But you can call me 678-983-9515. You can call me 24/7. um, it doesn't matter. Whatever time you want to call me, call me. I'm retired. I'm home all day, basically home all day. And if you have a question pertaining to erectile dysfunction or the implant, please give me a call. Give Chuck a call. If one of us cannot answer your question, we'll get with Dr. Shaw and we'll get you an answer. I promise you. Again, feel free to call me anytime you want to. Um, Again, my number is 678-983-9515. And with that, because they only gave me 10 minutes because they know I love to talk. So I'm going to turn it over to Chuck. He's going to talk about his experience and hopefully everybody gets something out of this. Again, thank you. And feel free to call me whenever you want to. Thank you. Chuck?
Hi, everybody. I'm Dr. Chuck. And as Richard said, Richard was my patient educator, and I thank him every day for um, his support and how he walked me through the challenges that I was having. Um, let's just go back from the beginning. I was faced with problems with a enlarged prostate and had been fighting the problem of getting up several times at night to use the bathroom and not being able to empty my bladder completely. And it was very dissatisfying for a couple of reasons. One, for me, but also for my wife. I just remarried 8 years ago, so I had a brand new wife, and all she knew was this guy that kept getting up several times during the night, breaking her sleep, and getting her upset. And I knew that I had to do something about it, that my problems were getting worse and worse. And I had tried a couple of remedies, non prescription remedies that were supposed to help And eventually they gave me um, a pill that's supposed to help you, which it did. It cut me down maybe from 6 or 7 times a night down to maybe 3 or 4 times a night, sometimes 5. But I was still having a problem. And I mentioned it to my doctor, a young physician, young female physician, and I told her how dissatisfied I was, that my quality of my life and my relationship with my wife was not good because this wasn't even about the sex. This was about keeping her up at night and waking her up. And she was the one said, "Can I make a referral to you to a urologist?" Well, the first thing that came in my mind was that urologist was somebody either that was going to remove your prostate or hang some kind of bag on you for you to be able to pee. And I just had a negative, idea about urology. But I said, I'm desperate. I'm going to go. So I got the appointment. I went, took several tests, and ended up having a procedure called a Eurolift. And the Eurolift procedure changed everything. It was a difference in night and day. I was able to sleep through the night, maybe getting up maybe once or twice, which is pretty normal, I think. And that worked really well. So on one of my visits, I mentioned to the doctor my problem with erectile dysfunction. Because as you walk through advanced urology, they have these models on the counter, and I kept seeing the models, but I didn't pay a lot of close attention to them. And finally one day I asked, well, what can you do about my erectile dysfunction now that you've solved the problem with my enlarged prostate? What can be done? And the doctor that I was working with, when I came back from my Eurolift surgery, I understood that he had left the practice. So they said, we're going to assign you to Dr. Shah. Well, I didn't know Dr. Shah, but the minute he walked in, I kind of fell in love with him. It was a bromance from the very, very beginning. He's very kind. He has a wonderful countenance about himself and bedside manner. And he answered all my questions. I know I asked him a million questions. I asked him a million questions, and he answered 1,000,001. He went further and beyond answering my questions. And so I began to gain some confidence in him as my physician to take care of this problem. And so he explained to me that there were several options that he wanted to explore and some tests. So of course we started with the pills, and I'd already known that the pills weren't going to, work. But I think he had a compounding pharmacy to make something up for me, and I tried it a couple of times, and it was of no help. And so when we did the test, we found out the cause was I had venous leakage. That's the bottom line, was that no, the pills, if I doubled up on the pills, it still wouldn't help. And so he gave me the idea of the Genesis and the Titan, the Toyota and the Rolls Royce, as Richard calls it, and I agree with him. And so I thought about it, prayed about it, talked to my wife about it, took the materials home and sat and thought about it, and then finally decided that I wanted to do this. Well, as I was leaving my appointment, I looked on the bulletin board and saw that very night, Dr. Shah was having a seminar. And so I asked my wife, do you want to go to the seminar? She said, sure. So we went to the seminar, and that's where I met Richard. Richard made a presentation that night. Dr. Shaw did a full presentation to everyone that was there. And I told Richard, I'm scared. I'm really, really frightful about this surgery. For some reason or another, it sounds so final and like, I do this, and then now, if it doesn't work out, then what do I do? And I had all kinds of questions. And Richard gave me his number, and he said just what he said to you. You can call me as many times a day as you want to call, and any time of day that you want to call. And he has stuck to that. And even though I am now a patient educator, we still talk because we're brothers. We still talk. And most of the times it's not even about prostate health, it's about life. But when we do talk, I am always happy to hear his voice. And I remember how kind he was to me. And I've tried to pass that along to the patients that I've been assigned. I've tried to make myself available. My wife is available to talk to their spouse or talk to them. We talk to people together. And I try to give them the practical experience from my experience, what I've learned and what worked for me. And I always leave them to open and say, I know your body might be different, but this worked for me. How about this tip? You need to try this maybe to help you out. And so it's been a wonderful journey. I said to one of my patients the other night, he said to me, he said, Dr. Chuck, suppose you had to do this all over again. Would you do it? I said, without hesitation, I would do it again. It is the best thing that I have done personally for my health and for my relationship with my wife. She loves Dr. Shah probably more than I do. Every time I go off for an appointment, she says, make sure to tell Dr. Shah I said hello and thanks. She says that every time. And it's just been wonderful for us, for our relationship, and also the people that I've met through service, serving other people who are going through this. I'm forming bonds with them. I think that will go on and on and on. So that's pretty much my story. I am so thankful to Dr. Shah, the staff at Advanced Urology, and the Coloplast people. They've been very, very supportive and everything. And you're in good hands. Should you decide that this is for you, you will be happy. You will get a good outcome, and you will be taken care of. Your concerns will be taken care of. The lowest moments in my life were sitting at my bedside with my new bride and not able to have an erection. I felt like a complete failure as a man. I felt like I was letting her down, and I just was not happy with my life. It never got to the point where we're discussing divorce because this is her first marriage, and she'd been waiting to get married. She married me at age 53, and it was just solely a disappointment to her. And I felt so bad because I'd run out of options. The pills and everything I tried was not working. And I really had kind of given up, as the old guys say, I was going to hang up my guns, and just, that was going to be the end of it. And through Dr. Shah's help and assistance, he's breathed new life into me, and it's been a joyous thing. So I hope that you will consider very, very seriously and going forward with the surgery. Should you get the information and it looks like it was something that's compatible with what you want to do. And I would not sit here and tell you, I do not think you'll ever regret it. And if you're like me, I'm like Richard, I wish I'd known 10 years ago about this. I would have done this 10 years ago. I would not have put myself through what I went through all those years. Negative self-image and self-esteem, all the things that your mind does to you because you can't respond as a quote unquote man. You can't be a man in the bed. And that's a heavy weight on you. It affects a lot of other areas in your life. And now I'm walking around whistling. I'll put it that way. How about that? And with that, I'll end. Dr. Shaw, you got to turn your mic.
Yeah. Yep. Thank you. Thank you so much, Richard and Chuck. I really appreciate you guys taking the time. These are not easy things to talk about. And I know a big part of why you became patient educators is because you do want to see other people, succeed. And I do appreciate that.